Welcome, everyone. Good morning, good afternoon, good evening, depending on where you are in the world. My name is Cassandra Jesse, and I'm a project director and senior technical advisor at ICRW in Washington, D.C., and I'm the moderator for today's panel discussion. Thanks to all of the attendees and speakers for joining us today for our project launch event. We are really excited. The event is Rebuild, COVID-19 and the Women in the Informal Economy in Kenya, Uganda, and India. So I just want to start us off with a few logistics. This will be a 1.5 hour event. We'll have some opening remarks, a presentation, and then a lively panel discussion followed by some Q&A and then some closing remarks. For the attendees, there will be time after the panel for that Q&A, and if you have questions for the speakers, please use the Q&A feature in Zoom, and we will get to as many of those questions as we can today. For tech issues, you could type them into the chat and our communication teams will work with you to resolve them. And so now I'd like to move to opening remarks, and I'd like to introduce ICRW's President and CEO, Dr. Sarah Kambu. Sarah?
Cassandra, thank you. And I join you in welcoming everyone to today's online project launch. Good morning, good afternoon, good evening, wherever you are in the world. Here at ICRW, we are just thrilled to be able to kick off this new global study. And I wish to start welcoming remarks by thanking our donors who believed in this vision and in the importance of this study, the International Development Research Center, IDRC, and the Bill and Melinda Gates Foundation. It's lovely that you're able to join us today. We look forward to your remarks. Rebuild will entail a multi-site comparative study to discern commonalities of women's experience in the informal economy and gather insights and learning from programs within their own context. Now, global studies are not new to ICRW and currently comprise 1/3 of all of our research studies. So we are very excited today to expand our global program of research through the Rebuild study. And this is important. Global understanding of these dynamics that are occurring in our world need this kind of very structured insight. And we feel that promoting cross-regional, cross-hemisphere learning in today's world is vital, particularly as we aim to address the compounding impacts of COVID-19 on women in the informal economy. Even if promising vaccines curb the pandemic, the economic fallout from COVID-19 will have much broader implications. Rebuild is our way of addressing some of these implications at the local level, with insights and best practices being shared and adapted across contexts. Today, from our speakers, you'll hear more about the state of COVID, the economy, and local policies. We truly look forward to the work that lies ahead. Thank you again for all of your engagement. I thank our speakers. I thank the ICR team and our partners for the important work that is forthcoming. And now I'd like to introduce my colleague, Dr. Ravi Varma, Regional Director for ICRW Asia. Over to you, Ravi.
Thank you, Sarah, for setting the stage so well. Good morning, good afternoon, good evening. I would like to begin by congratulating the team first for the hard work on conceptualizing and getting the project started off in such a timely manner. Much has been said about the devastating impact of COVID-19 on the well-being of nations and people. Rebuild intends to unpack the layered and the rippling impacts of the pandemic on women in the informal economy, who form the backbone of 3 project countries, as Sarah mentioned. Crisis often deepens existing social inequalities and vulnerabilities, leading to a range of immediate and long-term negative outcomes. This is visible foremost in the loss of women's agency and resources through events such as loss of schooling, forced and early marriages, increased gender-based violence, loss of work, wages and control over finances, sexual harassment in the workplaces, loss of essential sexual and reproductive health care, and so on and so forth. And we all know that Sub-Saharan Africa and South Asia together account for almost 80% of those living under $2 per day, and the two regions account for most of the world's informal sector workers. With Rebuild, we have the opportunity to learn from both these regions and understand the layered impact of COVID on the life of women in informal sectors. We know that while policy responses have mainly focused on containment efforts and providing care, uh, especially in terms of credit or cash stimulus, they have rarely included or even acknowledged the heightened needs of women, especially the upstream issues that drive women into gender relations that marginalize them. Rebuild adopts an evidence based advocacy approach in order to inform policy that is responsive to the specific needs of women workers in the informal economy in India, Kenya, and Uganda. And this particular project is rooted in the ICRW's deep understanding of gender norms, pathways to economic empowerment, and the gendered impacts of violence and access to essential health services. This project moves beyond an economic or a pure economistic analysis to integrate different dimensions of well-being such as sexual and reproductive health and rights and freedom from GBV. On behalf of ICRW, I welcome you all on this exciting journey over the next 2 years. We'll keep in touch, we'll keep bringing out the products and share with you all. With this, I would like to invite Mr. Arjan Han, Senior Program Specialist at IDRC Canada, to say a few words before we move on to the project presentations. Welcome, Arjan.
Thank you so much, Ravi, for that warm welcome. Thank you, Sarah, Cassandra. Good morning, afternoon, everybody. It's a great honor to join this project launch, and IDRC with the Bill and Melinda Gates Foundation are truly honored to be working with you on this important subject, important theme, important project. IDRC was as the pandemic started, mobilized a large part of its resources, like many of the other international development organizations, to support research organizations to provide the evidence that is needed in particular contexts. And IDRC ended up with some 21 projects in a cohort with some 40 organizations, including ICRW, to support the building up of the evidence that you were the kind of evidence that you were referring to Ravi. And in that program, in line with Canada's commitment to gender equality, our feminist international policy, we tried to make sure that gender was mainstreamed in all the research, and I think the ICRW project stands out as one of the projects that focuses particularly on vulnerable women, as you've pointed out. And I mentioned that larger cohort because also Sarah, Ravi, we're looking forward to learn to have the ICRW expertise inform the other research. Not all projects are equally good on strong on gender equality, and we very much hope that we can create a forum for learning across those organizations. From the earlier work we've seen, and these are not things that are new to you, but I just want to highlight three elements that I think will come out of this research, is coming out of the other projects. First of all, of course, the pandemic highlighted and amplified many of the pre-existing inequality, gender being one of them, and one of the issues we'll see is the continued growth of those inequality, increased burden, reduced access to labor markets, and also whether the existing policies sufficiently address those inequality. And we already see that if that's not done sufficiently, that the policies fall short and potentially enhance those pre-existing inequalities. The second thing, of course, very, very important, and the theme of your research speaks to that, is the multifaceted nature of this. It is a health pandemic that very quickly, particularly in low-income countries, has this huge impact on economic and social factors, access to labor markets, people losing jobs, small businesses closing, and an immediate impact on household relations, deep gender inequalities, violence against women, change early marriage, and so on. This is a multifaceted pandemic, and particularly in low-income countries where government's capacities are relatively limited to address those. And the third thing I want to emphasize is the importance of intersectionality in this. In Canada, we are very fortunate to have seen the first vaccinations, and very importantly, this was very symbolically, it was a Filipino nurse that was the first that's vaccinated, and that all makes us very happy, and we hope that it will be spread. Filipino nurses also were by far the most affected group, and the reason for that was intersectional. It was because it was these are women, because of their ethnicity, and because of their migrant status, and because of their labor market status. There again, the pandemic has highlighted those inequalities, and has highlighted the intersectionality of those those inequalities, and that's where we need much more of the evidence and much more of the forming of the policies to address those both deep-rooted and very complex problems. So with that, I'm so honored to be joining this launch with the project All Success, of course, and again, thank you very much, Ravi. Sarah, back to you.
Well, I'm going to invite my colleagues to start their presentation. So Sharamista and Carolyn, I welcome you to join us.
Thanks, Cassandra, and thanks to all the speakers for setting the context for our presentation so well. Before getting into the details of the project, I would like to reiterate that we are living in a much more unequal world than we were before the COVID-19 crisis hit us. And this is a global phenomenon. But as we know, the worst hit are those who come from the poorest countries, from the poorest households, who belong to the lowest socio-cultural groups within these country contexts, and are also most often employed in the informal economy. This also means that they are at a greater risk for regressive normative and policy shifts, which often happens in a context of crisis. And these shifts could include impacts such as enhancement of harmful gender norms, and also increased suffering due to insensitive policy measures. And to speak to these multi-layered complex issues, Rebuild aims to forge a collaborative effort across these country contexts, as well as within other networks and groups in the countries, to work on an intersectional framework and a gendered policy analysis on the influence of COVID-19 on women in the informal economies. Next slide, please. Thank you. So some of the primary objectives of our research in the Rebuild project are, as mentioned, to understand the scope and the nature of what were some of the policy responses in the context of COVID-19, with a focus on women in the urban informal economies in Kenya, Uganda, and India. And to do this, we also have a specific objective articulated around being able to collaborate more closely with policymakers at the local and state level context within the three countries, to understand what mitigation measures were implemented, what were some of the challenges, and who were the most important stakeholders in the pandemic response. And needless to mention, one of the key objectives that comes along with these two is to work on translating research evidence into action more consciously. Next slide. Thanks, Joe. So, and in order to do we have broadly divided our research activities into 3 phases across the 2 years of the grant. So the first phase is inception and scoping, which is mostly around looking at macroeconomic data and literature that exists as of now, trying not to reinvent the wheel around what we know, but to use what we know and collaborate with our peers and other organizations globally, as well as within the country context, to come up with more robust and more relevant hypotheses at the time when we get into our next phase, considering that COVID-19 gives us a very dynamic landscape to work with. And in the next phase, which is the deep dive, we will be using a range of primary research methods, which would dive into the experiences of women in the informal economy. And the last phase would be of consolidation, which would help us synthesize all the evidence generated and work concertedly with the ongoing engagements through the earlier 2 phases. With the several stakeholders and policy actors within the cross-country and national context. And I'll stop here and invite my colleague Carolyn to take us further into the 3 country insights. Thank you.
Thank you, Shamista, and good morning, good afternoon, and good evening to everyone who's joined us today. And building up from what the other speakers have said, we all know that different countries took up different approaches to COVID, and the health impact of COVID seemed to have, received a lot of premium across the different countries. And where we are at now, we are looking at how do we need to be able to address the impacts of COVID with focus on a population that seems to be invisible. And this is the informal workers within the urban spaces. So just give us a brief overview of the 3 countries where we are going to be implementing this particular project. And the basis for these 3 countries is also giving us as ICRW and players out there who've done a lot of COVID-related response interventions, just a brief understanding of how do we need to be able to understand the intersectionalities within the informal economy? How do we bring out the gender dimension when we are targeting that particular population group that contributes heavily to the economic status in the 3 countries, but however seems to have missed out on the various policies that were enacted. So starting off with Kenya, we know that there are several fiscal, monetary, and social protection policies that were rolled out starting March of 2020. And as you would see, most of these particular policies were aimed at either exempting the population from certain tax requirements, looking at being able to cushion businesses from value-added tax. A lot of mobile transactions, business rely on mobile transactions in country. And as a result of COVID, there was an exemption, a waiver of the fees that are associated with these mobile transactions. However, we also noticed that the economic stimulus package that the government rolled out aimed, in as much as it aimed to cushion us from the economic pandemic, the economic shocks, we realized that mostly it's the small and micro enterprises that seem to have benefited from this particular package. And in country, we had 10 billion shillings allocated towards the social protection mechanisms. And how these social protection mechanisms work is basically to ensure that there is cash transfers to vulnerable households. However, looking at the informal space, we realized that mapping of these particular vulnerable households is something that really begs a question, because how do you define vulnerability within a context whereby the pandemic has increased the number of households that have been made vulnerable? Secondly, most of the workers who are within the informal economy are not registered, or they're staying in places where they are not able to access on some of these protection mechanisms. So as a country, we have realized, based on the evidence that has already been generated, that the informal workers have not been protected by these particular policies. While the tax incentives were meant to cushion employees, we realized that many have not benefited from this because they fall outside the tax bracket. Next slide. So just taking us through how these policies have impacted the women within the informal economy. One, as a country, we realized that the health the spread of COVID was, addressed from a health perspective. So basically all the restrictions that were put in place were aimed to ensure that we curb the spread of the pandemic. And this resulted in business closures, in school closures. And as a result, we realized that with the restricted movements, this translated into many households not being able to access services. We're looking at the sexual and reproductive health services. And as a result of the restricted movements, we also noticed that the enclosure of, households and also restricted social networking within the communities translated into increased GBV risks. And GBV risks here, we're also looking at increased violence against children at the household. From a business economic perspective, we are looking at having restricted the movements and also introduced curfews. It meant that there were reduced incomes that the households were bringing back home, resulting into limited disposable income that could be used to facilitate access to health, reduced incomes that would also guarantee food security to the various individuals, and lastly, adaptation of non-conventional treatment because of the, not having the ability to move out to access services, and then also looking at the fear and the stigma that was associated with persons going to the health facilities for services. And lastly, as a result of these particular restrictions that are placed in country, we realized that the burden of care on women significantly increased. And this also translates to them having a reduced bargaining power at the household level, and also not being able to make decisions within the household environment on how they can use the meager resources that are at their disposal to be able to balance out the various requirements that would emerge within that particular family environment. So for us within the country, we are looking at being able to go a step further to understand what is the gendered impact of these policies and what needs to be done to ensure that women within the informal economies and the vulnerabilities that arose as a result of the COVID pandemic are mitigated, and also looking at how do we leverage on the evidence that has been generated and will be generated through this project to ably engage with the various actors within the country. Next slide. So for Uganda, we're also looking at similar situation with Kenya. The informal economy contributes to 43% of the GDP, gives employment to 87% of women workers. When you go a step further to look at the extent to which these women have benefited from the economic stimulus package that has been rolled out in country, we realize that the informal sector has been excluded. And the exclusion comes in as a result of the job losses that have been experienced, especially by those within the small and micro enterprises. And from a social protection mechanism infrastructure in place in country, we are looking at only a population of 3% being able to access the social protection mechanisms. And this begs a question of what needs to be done to ensure this 87% women workers who are within the informal urban economy, as time progresses, stand to benefit from the social protection mechanisms that the country would want to roll out, or how do we generate evidence that would also speak towards the country being able to think through the social protection mechanisms from a gendered perspective. Next slide. So for Uganda still, we went a step further to look at how have the informal workers benefited from these policies. While we've had several guidelines rolled out, clinical management policies rolled out to curb infection and also to guide the health sector response to the pandemic, we've also had, at the onset of the pandemic, we also had mobility restrictions introduced. There were lockdowns that were introduced, and this translated into work closures, resulting into lost livelihoods. Mobility restrictions resulted into increased domestic violence, which at 62% by April of 2020. In as much as we had the government roll out the economic stimulus package, this package has mostly benefited registered businesses. So those within the informal urban economy are also left out. In terms of employment interruptions, because of the policies that were rolled out by government, employers were put in a situation whereby they also had to look at what would be feasible for them to maintain their operations. And at the end of the day, the employer, in some of the cases, had the discretion to determine whether to let go of some employees or not. So we've had both those within wage employment and those in salaried employment lose their income because of the impact of the pandemic has had on the various businesses. And lastly, we've also noticed that the government has also, over this months from when COVID struck in Uganda, has also increased the spending to the vulnerable groups. However, we need to be able to understand what needs to be done in country to be able to get to a point whereby the informal worker gets to benefit from the economic stimulus package, tap into the social protection package, and finally also look at how to mitigate the GBV related risks that have emerged as a result of the policy stipulations that have been released by government. Over to India, thank you. Next slide. So in India as well, you'll realize the common feature across the three countries. It's the space that women workers occupy within the informal economy and the contribution of the informal economy to the broader GDP. And this situation is not an exemption towards what the Indian context is. Currently, we are looking at unemployment levels in India have reached to a point of 24%, urban employment being at 26%. However, in the Indian context, we go a step further, not just to look at the impact of COVID from the loss of job opportunities and also limited employment opportunities that are there, but we are looking at how women and the informal workers have not been able to benefit from the policies that have been rolled out. And secondly, their continued stay within the urban infrastructure means that they're not able to access certain amenities, being able to pay for toilets, being able to access clean water, being able to access transport as a result of the reduced incomes or business having closed. And looking at the Indian situation as well, we're looking at a majority of the population within the urban space who are dependent on the social protection schemes have been excluded from it. And we've also had a lot of workers migrate towards the rural, economy. And secondly, by them migrating, we've also had an increased deaths, increased vulnerabilities to negative health outcomes, and also them not being able to access healthcare. Next slide. So in terms of the impacts that these policies have had, while they sought to cushion the informal workers through provision of free food rations and direct cash transfers, we realized that these particular social protection mechanisms and economic stimulus packages cannot be compared to the need on the ground. And also, secondly, they left out the migrant workers who form, a huge population group within the informal economy. And secondly, we're also looking at these particular policies do not provide support to the worker within the urban space insofar as access to housing and other social amenities are concerned. While the government rolled out a fiscal stimulus package that sought to, incentivize small and micro businesses to boost production, create jobs, and increase domestic demand for products, we realized that this particular package mostly focused on those micro enterprises and exempted the cottage industries that are mostly run by women. And these cottage industries are operated from the home environment. So meaning we have a key issue that we need to address as we look at the microeconomic situation within the Indian context. What needs to be done to cushion and also to mitigate the impacts of COVID on the women who are running these nano production units? While this fiscal package would also be considered to have been good for the business space, we are also looking at the levels of indebtedness that have increased as a result of this particular package. So where we are at now, we realize that there's been increased loss of jobs. We've also noticed an increase in state-inflicted violence. Orders have been canceled because of, a shrink in economy. And lastly, certain employees have also lost out on their earnings, especially those that are, earnings that had been accrued before the pandemic struck, because the employers are not able to raise monies to be able to pay for this particular service that was offered. So in closing, as a project, next slide. In closing, for us, we are rolling out this project from an understanding that we already have evidence that has been generated across these three countries. We also need to collaborate with partners that are already implementing and seeking to mitigate the impacts of COVID across the various population groups. For us, our focus is to strengthen the in-country research and uptake efforts, so that as we are looking at the gendered impact of COVID, we are also able to clearly inform our policy environment with focus on the informal urban economy, and also being able to clearly help our policy actors understand the reason why we need to place premium on women who are contributing heavily towards the informal economy. Secondly, we're also looking at creating a platform that will generate a lot of cross-country learning opportunities, look at the gaps that are existing, how do we bridge those gaps, and also being able to shed more light on some of the questions that remain unanswered. And for this, we'll closely collaborate with the communities of practice that have been rolled out by the Gates Foundation, by IDRC, and various donors out there, so that at the end of the day, we are building into the evidence that has already been generated. And secondly, also building evidence that would speak towards the low and middle income countries. Thank you. Over to you, Cassandra.
Great. Thank you, Sharmista. For really, this was exciting to hear this plan coming together and the opportunities that we have to generate the evidence needed to support women in the informal sector. As you outlined, these women really have been disproportionately affected by COVID-19 and have often been missed in this policy response. And I was reflecting on my own experience with positive youth development, which takes this holistic approach and succeeds most when we're working across sectors. And this challenge too requires that intersectional approach to be able to translate what we have learned to create then an actionable agenda for a robust policy response. And I think that segues into our panelists. We brought together a panel that reflects some of the different economic and gendered aspects that impact women in the informal sector. And we're asking them to reflect on what Rebuild sets out to do and provide their insights on where there's opportunities to make a difference. So I'd like to introduce our three panelists first, and then would like for them to reflect on the plan that Carolyn and Sharmista set out, and then start some questions. And then we're going to have the audience, the attendees, be able to ask some questions. So just as a reminder to the attendees, please put your questions in the Q&A and we will get to as many as we can. So first I'd like to introduce Nzenze Wiri. She is a development economist with Financial Sector Deepening based in Kenya. And Nzenze's experiences focus on Africa, on economic research, analysis, and strategy development with an emphasis on macroeconomics, manufacturing, private sector development, financial sector development, and trade investment. So well covered in the economic space. I'd also like to introduce Damali Sali. She is a Ugandan trade development expert and country director at Trademark East Africa in Uganda. Damali is playing a leading role in supporting Uganda to ensure that trade continues safely and that livelihoods are protected during COVID-19, particularly along transport and trade routes. And Soumya Kapoor Mehta is the head of the initiative of What Works to Advance Women and Girls in the Economy. She's based in India, and Soumya leads iWage's effort to generate, leverage, and synthesize research on women's economic empowerment. So welcome to the three of you. Excited you are here. And I'd love to hear your thoughts and reflections on what my colleagues have shared. Just sort of a quick 2 minutes. And Soumya, since you came up first on my screen, I'm going to have you start.
Thanks very much, Cassandra, and thank you so much, Caroline and Sharmista, for the terrific presentation. I think it just, the plan that you have laid out for the Rebuild program, the 3 phases are very well structured. I think it's very good to start off with what others are doing in the space. There's just a lot of evidence that's being, at least I can speak from the Indian perspective, which is being collected across for informal workers, including female informal workers. The Niti Aayog is planning to do a big study on urban informal workers, and it would be good to just clue into the evidence that and the data that may be gathered there. So I really liked the sort of 3-phase approach leading up to advocacy, and even setting up these rapid groups, for take up of findings, policy groups. So I think the approach is fantastic. And in terms of the I think the evidence, I think Aryan laid it out very well. These inequalities were there even earlier. So if you think of the informal workers, at least in, around the world, and as is the case in India, they were lacking social protection, particularly women. They used to face harassment, assuming, you're a street vendor. And these have gotten heightened, these risks with COVID. So, I like the example that Aryan brought out about domestic workers. Domestic workers actually have been, at taking on these risks because they are living in these close quarters with their, households that they serve. And therefore their risk is high. Similarly, waste pickers, how do you actually practice social distancing with them? How do you tell them how to segregate, stay away from risks or from the virus? So I think there has been a lot of work that Viego and other organizations have done, and it'd be useful to actually build on that evidence as well. I think the last thing that I would like to say, in terms of, again, from an Indian perspective, I think the impacts that were laid out on the Indian slide are more or less true, but it's so dynamic the way COVID has evolved and the response to it. So, for example, in the initial days, yes, there was a struggle on how the PM Garib Kalyan Yojana, which was the main relief measure that was offered to these workers, reached them, but then it got extended. Initially, there were hiccups because there were identification issues, but then there are best practices, like, there are states like Kerala where civil society worked with the government to reach to urban informal workers who did not have IDs. So I think it'll be useful to bring those out and be a little careful in just having blanket sort of assessments that it did not work. I guess there would be islands of successes where the relief schemes did reach out, perhaps in partnership with civil society, perhaps because some digital innovation was adopted so these people could be identified. And I think it may be good to also identify those, so then we can understand what really works or what needs to be done if these relief efforts have to reach the segment to rebuild better. But I'll stop there.
Great, thank you, Soumya. I'm going to pass to Nzetsi, but before I do, Damali, if you could turn on your camera, I'd love for you to join us sort of in the panel spread that comes up over the panel itself, so that way we can see you. So Nzetsi, I'm going to have you reflect on your thoughts about where the rebuild is going and what you had heard so far.
Thank you, Cassandra, and thank you to the team for the specificity and clarity that you have in terms of the approach that you'll be taking. And I do agree with a lot of the insights, particularly in Kenya, around the very specific feminized effects. I think something to consider is the framing of women as economic agents. I think often those of us who do have a gender lens in what we do risk siloing women out. And so what that does psychologically, if you're looking at it, particularly from macroeconomic policy prescriptions, is that women are then siloed as, okay, we'll have to deal with them later, right? So I think if we can encourage a framing of women as economic agents, particularly with the view of delineating feminized sectors and where women sit in terms of owner managers and also in terms of just labor. Then from a macroeconomic perspective, you're looking at policy interventions, whether it's in line ministries, whether it's in partnership with development partners, it becomes a bit easier to start allowing the leveraging those levers to those feminized sectors. So I think centering the economic, women as economic agents is very important. I think the other big thing, in terms of the intersectionality is the business environment. I think, frankly, one of the main reasons the informal sector continues to wallow in total neglect in terms of policy intervention is because it's dominated by women. And if you look at the very specific business environment issues, now I'm talking about rebuilding and recovery, right? If you look at the structural constraints female informal workers have to deal with, in terms of the business environment in which they operate. This has to do with the premises, this has to do with safety and security issues, this has to do with the socioeconomic reality that they're the caretaker, so they can't run their businesses as long. All these different things, they often don't have as much help to run the business, therefore their productivity is impacted. There are all these very specific business environment issues that really need to start getting articulated well, and that need to start being dealt with by both government and development partners, so that women aren't going back into the horrible business environment of the informal economy that they've been having to grapple with. And a very big one would be market access. Even if you're looking at the recovery of women in the informal sector in particular, I think market access is very, very important, and the restoration of demand. Because if you're looking at one of the biggest constraints to recovery, particularly for self-employed women, the bulk of which are in the informal sector, and the bulk of women in the informal sector are self-employed, is a lack of demand. And so one of the things I think we need to also think about macroeconomically is how do we support African governments, or in my case, the Kenyan government, to create fiscal stimulus measures that will allow firms to start conducting business activity again. Because one of the biggest barriers we've seen is that even if women are out there trying to sell goods and services, there's nobody buying. So I think really having a more holistic macroeconomic effect and leveraging the government policy operational machinery, I think is important. So I think the final thing would be a need for a special focus on the girl child. The absolute decimation that's happening to the girl child now is going to be a tragedy that we'll see in about 10 years. And I think we need to take really quite serious measures around the heightened levels of sexual, physical abuse that girls are facing, children in general. Also just the neglect in terms of food and meals. One of the big ways households are coping is by missing meals, is by foregoing care. These are the basic things, and therefore the impact that it has, particularly on children. And then of course now in countries like Kenya, we're seeing a rise in what they call child pregnancies. In my view, I think that's just an indication that the exposure that those girls are having to predators and pedophiles is quite pronounced. And so when you're seeing from a recovery perspective of our children, particularly the girls, there needs to be a very deliberate effort to address the heightened level of sexual and physical violence that girls have faced, and to deliberately support them to get back into education. And this will be intersectional, because one of the challenges we've seen around COVID is that one of the coping mechanisms a lot of people use was to eat into their assets. Most of that also being educational savings that they had to educate their children. A lot of people have drawn down on them. So we're creating an ecosystem where there's a real risk where the girl child may really be quite forgotten. So I think that's something else that I think would be quite important going forward. Thank you.
Great, thank you, Nzetsi. Damali, would love your insights and reflections on the presentation and your thoughts.
Well, thank you so much. And I mean, I'm happy with what Caroline said about Uganda. It was a good snapshot of what exactly is kind of happening in Uganda. But maybe just to give some context from the trade perspective where I usually sit, is that Uganda went into a complete lockdown in mid-March. And that was when the impact on domestic trade and informal cross-border trade cannot even be overstated. First, if I talk about domestic informal trade, between March and July 2020, all businesses were closed except for those that sell food, and only markets were allowed to operate. However, anyone selling food in a market was required to stay in the market day and night because movement was not allowed. Please note that over 80% of the food sellers in the markets are women. So this meant that these women slept in the markets, away from their children, away from their families for days on end, under improvised beds, mostly on the ground, until June 2020, when minimum movement was then allowed. And then also over 65% of informal domestic traders are actually women. And all this informal domestic trade was completely shut down for 4 months. So these women had to use the little capital they had in those 4 months to feed their children. So by the time the lockdown was eased in July, they didn't have any capital anymore. They had eaten it up. And in addition to that, they usually borrow money from SACCOs and microfinance institutions. Normally, that's where they borrow this money from. And because none of them was paying back, these institutions had also basically, failed. They couldn't lend anymore. So these people have actually lost their capital. These informal domestic workers lost their capital in that 4 months when there was a complete lockdown. And if I go now to informal cross-border trade, this is a trade across our borders at the borders between Uganda and its neighbors. According to the Bank of Uganda, in 2019, informal cross-border trade between Uganda and its neighbors was valued at $550 million. However, this trade $550 million worth of it each year, all but disappeared in 2020 because informal cross-border markets were completely closed. Now, the informal cross-border markets, they actually up to now have not been officially opened. So these people who were selling $550 million worth of stuff across our borders lost all their capital. And over 80% of informal cross-border traders are actually women and youth. And they mostly sell maize, beans, sugar. They sell it to South Sudan, to Kenya, to the Democratic Republic of Congo, Tanzania, and Rwanda. You know, Uganda is lucky we have that many neighbors. So we are able to sell stuff to those many neighbors. So because the markets have been closed for that long, these women have been deprived of a source of income for over 4 months. So across the borders, the border markets, they allow formal trade, but informal trade has been shut down since. In desperation, these women, these informal cross-border traders, have resorted to using risky unofficial routes to still sell their goods across the borders. But this has resulted into a spike of cases of rape, sexual harassment. I mean, this was there before, even before the lockdowns, but now it's even much more exacerbated. So they are in taking this risk because they haven't been able to trade officially. In taking this risk, there is a spike of rape, sexual harassment. Sometimes they entirely even lose their goods or even lose the money to start with. So this, I feel like informal cross-border trade has been impacted extensively and continues to be impacted to this day because the government rightly so saw the borders as the high-risk areas where there'll be a lot of movement and therefore transfer of COVID between countries. So they've locked those informal cross-border routes and informal cross-border trade entirely down. And to this date, officially, you can't buy and sell stuff, informal stuff at, say, the borders between Uganda and Kenya. But just to put it into context, this was $530 million worth of things that were sold annually. 80% of the people involved in this informal trade are women. They look after their children. They've lost their livelihoods. And that continues to be so. Thank you.
Thank you, Damali. I would love to have all our panelists, if you guys could all turn on your screens, just because I think that we'll kind of move into some questions, I think we'll have some questions to be able to bounce back and forth a little bit more. And so I have a few questions that I would like to ask, and then I'll open it up to the Q&A. Although looking at some of the Q&A, some people are asking some of these exact same questions. So let me start with you, Soumya. How well do you think the COVID-19 policy response so far have addressed the needs of women in the informal sector? So thinking about what's happening currently, what might be some bright spots and areas to think about as other countries look to do better by women in the informal sector?
Well, I think, I mean, again, talking about India, there have been some measures which have been announced by the Indian government. For example, we have a public work support program known as the MGNREGA, where you can get about 100 days of manual labor, and then you will be paid accordingly. And then the government has now announced that it would open up more work, so actually people can be employed in these public works. The issue is that it's actually running out in terms of the demand is much more. So people are maxing out on their 100 days because they would have worked earlier as well, and therefore the demand that's coming to the government is actually to raise the ceiling from 100, say, to 150 days, because it's an unusual situation for the pandemic, which then goes back to whether there's a fiscal space that's available to do so. I think in terms of the outreach of schemes, as I said, there are a few bright spots that are available. Usually things that have worked in the favor of so the scheme is available. The issue sometimes seems to be the identification. But as I said, sometimes there have been civil society connects, like SEVA has worked, for example, and there is state level variation. So SEVA, for example, has worked with the Delhi government to issue informal workers, women who don't have ID cards, to access the food rations that are being made available by the government. But they don't know how to apply for these e-coupons. So the SEVA people then do offer those last mile delivery services, that here's how you go on the internet, here's how you apply for the e-coupon, and therefore you are able to then access your food ration. Similarly, it's also about how a lot of these informal workers also, as somebody said earlier, work in these, supply chains where they are working from their homes. So they are home-based workers. Now, because of the pandemic, all the supply chains have been disrupted. There are no markets that were open initially, particularly, if you're working in the garment industry, you've been cut off from raw materials as well. So how do you pivot? And a lot of civil society organizations have been working with their workers, providing them even training over WhatsApp or, some digital training either in urban or in rural areas on this is how, you can pivot your agriculture to do kitchen gardens. This is how you can stitch masks. And that's also, and the government's entire National Rural Livelihoods program, which is NRLM, which just aggregates women into self-help groups, has also been doing all of this mask making. And so it's also a question of how skills have pivoted. And I think the one bright spot is that if you actually interview some of these women-led small nano enterprises in the first few days of the pandemic, and there have been surveys that have been carried out, repeat and refresher surveys with these women, they said we will not be able to restart our enterprises because of unpaid care work burdens, etc., increasing. But now they are saying that there seems to be hope as the economies open up. I think that what they need is a lot of handholding. They need in the case of civil society, it's been available. In the case of NRLM, a lot of the ground staff, CRPs, the community resource persons have been doing that. In the case of India, if you do that, and I think for the project to document these sort of practices on what last mile delivery services or digital efforts or whatever are needed for people, for these women to connect to whatever relief schemes are on offer, would be a great value addition, I think, for the project.
Thank you, Soumya. We will, I know the team is listening closely, and so I'm bearing that in mind. And Zetsia, I'm wondering if you could share your reflections and thinking about the influence of gender-based violence and sexual and reproductive health outcomes for women and their families, thinking about the challenges that they're now facing given COVID-19, and what ways can kind of focusing on the livelihoods in this informal sector help mitigate that, and what can we do going forward?
Oh, thank you. And I think just before I answer that, I just think that one of the things we have been tracking is the um, adaptation mechanisms that women have been using, and there are about 4 that we've identified. One is offering a new product with their existing skills, some offering new products by learning new skills, some are going digital, although we need to be quite careful around the push around digitization because you start building in inequality there, but some are offering new services. But now to your point around sexual and gender-based violence and how, how do we manage that going forward? I think first of all, we have seen certainly in Kenya, and we do participate in and co-develop a lot of trackers, some with other people in Kenya, some with the government, some with international players. And we have seen certainly an increase in domestic violence, as I've already said. It seemed to have spiked in around August, but it seems to be going down. But still, there is that sort of underlying reality. I think if you look at it from a female perspective, there are really 3 ways gender-based violence affects women. First is just in terms of the capacity to direct the mental and financial bandwidth to the economic production activity that she has chosen to participate in. If you're looking at it at firm level, the safety and security of her premises has a real impact. And because women are more vulnerable from a security perspective, it means any assets that she has, any business items that she has, and her physical security is a going concern in terms of a woman to apply her full capabilities to whatever business endeavor that she chooses to have. That is particularly important because in the informal sector, the premises tend to be very shoddy. Security of tenure generally doesn't exist. And of course, eviction is something that is always hanging over the minds of a lot of women as they're trying to conduct their business. And so the reality means that a lot of women have to close their shops early because security risk is a real risk for them. So I think that's one way at a firm level that really affects women. And so that's why I'm saying this is a business environment issue. I think we should stop calling this a women's issue. This is an issue where people in the informal sector, this is a chronic problem that they have: inadequate physical infrastructure where they can conduct their activity. So I think if we can frame it that way, that may help. I think the second big way gender-based violence has on women, obviously, is financial and economic autonomy and financial and economic equality. One of the things that we do as FSD Kenya is we take a pulse on financial health of Kenyans every 3 years. And women always have far worse financial health than men. And we're going to probably see this getting worse into 2020. We're going to do the new survey next year and the year after to see the impact of COVID. And so when you look at gender-based violence and the ability for a woman to be economically and financially autonomous, there's a real risk that happens there. If you look at the way women have had to eat into their financial savings, some of them may have been private, maybe nobody knew. She was securing that financing for purposes that she knew for herself. So her financial and economic autonomy has been compromised going forward. Therefore, it really risks her being pushed into domestic situations that she perhaps was trying to get out of, or may compromise her welfare even further. So I think really looking at the way women organize their financial lives and finding ways to support them. And this sometimes is something, does not mean you go shouting the gender flag. Sometimes it just means being quite intelligent around the groups that you work with, the sectors that you work with, because it is important that we support the ability of women to be financially autonomous without creating a backlash, that sometimes I think everybody knows tends to happen. So I think being quite intelligent in the deployment of that strategy to really foster that economic freedom as a recovery will be important. And I think just the third one is what I already mentioned, which is the girl child. The assault that the girl child has basically been having by being in the domestic space for 9 months. We all assume that the home is a nice space. A lot of girls are in domestic spaces that are very dangerous, and in which their welfare has been compromised now for a very extended period of time. And this has impact because we've been tracking the journey of a woman's financial health as she gets older. Education has a massive impact on the ability of a woman to be financially autonomous, but more importantly, childbearing has a massive impact. If a woman does not have the power to choose when she has a child, that really does impact then the journey of her financial and economic freedom going forward. Now, this is happening to girls who aren't even ready for the situation. And that's why I think it's very important that government gets quite serious around dealing with the exceptional assaults on girls with exceptional remedial measures. Because otherwise, we do risk just saying, oh, well, that is a household issue that has to be dealt with. But this is really an issue about the holistic welfare of girl children in particular, because they bear the brunt of pregnancy. That's apart from the psychological stuff, it's the pregnancy thing that really starts to have a structural impact on their ability to recover going forward. Thank you.
Thank you. I'm going to kind of build off of almost your second point. And Damali, I'm going to ask you, in thinking about some of the sort of either best practices or sort of resilience strategies that could help address the needs of women, and thinking of it from more that business operation, social protection type of lens. So take it away.
Thank you. One of the key things that I keep thinking about is technology, and how it can actually help a lot of women to, first of all, access business, continue to do business, but then also protect themselves from physical spaces, which they probably then do not need to go to be able to do their business. So when I think about it, a lot of the, for example, when COVID started happening in Uganda and there were those intensive lockdowns, I do remember vividly the Ministry of Trade in Uganda partnered with the private sector. We have Jumia, and then we also have Safe Border, partnered with them so that they can develop their platforms to target women traders so that they're able to trade through these e-commerce platforms. The idea was that, okay, because they can't easily physically move around, if women can be encouraged to use these e-commerce platforms to still be able to do their business, still get an income, then it will help them to continue to trade and then also move themselves out of these physical spaces and protect themselves from, say, physical abuse and sexual harassment. And this, I thought, was a great idea until it started implementation. Now, like about 6 months down the line, it was found that yes, the women got onto these platforms and did try to start to trade using these platforms, and people had started buying things from them. And in fact, yes, it was more protective for them. However, what we found was that they were jumping off the platforms, not because they don't want to use them, but because the platforms were paying them 2 days later, 2 days. So for the women, not having their cash, they've sold their goods, and then they don't have cash. They have to wait for 2 days to receive that cash. That in itself, for them, was so significant that they couldn't stay on the platforms. Now, which is sad, because I felt if this platform can give them their money in real time, this would have solved that problem. Actually, they would have continued to trade, continue to have a livelihood, remove themselves from these physical spaces, which then they're not abused. But because of that small amount of cash, it appears small to the e-commerce platform players that, yeah, you give us your goods, we'll pay you 2 days later. It doesn't appear like a big deal. But for them, it's actually the difference between, do I continue on an e-commerce platform even if there is business, or do I not? Because they don't pay me in real time. So we need to think of ways of leveraging technology to facilitate, to allow these women to continue to do what they need to do, but in a way that allows them to still have their income. So in a way, financial inclusion, trade, business, all those things we can leverage technology, find out a way to figure out how do we fill these gaps technology-wise. The other thing, of course, as we do that, we need to take into context the fact that there is a digital divide. Someone asked a question about, teachers, female teachers who in the lockdown, had to teach, but then also had to look after their kids because they are, at home. That digital divide is so huge in Uganda, at least, that a lot of females actually cannot use applications. So whenever you have an app or a digital solution that is digital, women mostly just call and answer phone calls and answer, make a call and then answer. So that digital divide also has to be taken into context as we're developing all these, or trying to develop technologies that we can leverage to take women out of spaces that don't protect them. Because if you also think about technology, it's one way to protect women's money. If you have money on mobile money, it has been found, there was a study array, that the women who have mobile money wallets feel that they are more financially secure because they have more control. Because the money is not in cash, the husband can't take it. Because the money is not in cash, someone can't steal it. So they found that is important to do. But as we develop technologies, so my answer to you is that, first of all, technology is the way to go. We need to develop solutions that target those gaps that affect women so that we take them out of physical spaces. But the technology has to be developed in a way that addresses those critical gaps that afflict women, i.e. they need their cash in real time. Secondly, they don't know how to use technology, so they need to be, the applications have to be developed in a very simple way. But we also need to make sure that we incentivize them to use technology, because without technology, women are actually being left behind, so far behind, because unfortunately, the world is moving along with technology. And if women don't, jump onto the wagon of technology, then nothing will really happen. If I can, I know I'm running out of time, but if I can just talk about these informal cross-border traders, because I'm a little obsessed about and upset about the fact that they don't have an income anymore for 9 months. But if I can think of a technological solution that allows them, a woman in Uganda, to still sell her stuff to South Sudan, she gets a buyer on an app. In South Sudan, they pay her by mobile money, she gets the goods. And then that app also has a logistics solution so that the goods are picked from her and delivered into South Sudan. That way, first of all, she'll have her money in real time. She will not have put herself at risk going to South Sudan herself, traveling with the goods or traveling back with the cash. And then also it will enable her to even be in Uganda and take care of her kids. So she can still trade as she does her family business. So for me, I find that I see whatever it is that we are trying to develop, we should ensure technology is one of those things that are used as a catalyst. Because if we leave the women behind right now, the next generation is going to be even further behind, because technology, we can't avoid it. That's just the way the world is now. Thank you.
Yeah, I think technology will be an interesting sort of discussion point, hearing, the inequalities that exist in that space, but thinking about how it does help advance. And so I'm going to move to a few questions that have come in through the chat. And so Megan and Donald asks about is around the solution around increasing government funds. And so how much, or what would you say is the solution around increasing government funds directed towards social protection programs to informal firms, and how could this be done in the context of shrinking fiscal space? So I'm wondering who might want to take that question.
I mean, I could, because we're actively working on this. I think one of the ways that that can be addressed is by getting better data, um, so that the decisions being made can be justified in a very difficult political economy context. Um, and the should I continue? I think I got kicked. I got lost. Can you hear
Yes,
me?
sorry, I think I also got lost. I seem to have frozen on my end.
No, me too. Everybody seems so frozen. But
Okay.
I think just to say, I think the data question, which hasn't come up yet, interestingly, is a really important one, because that is sort of the justification for the type of stimulus models that you have in terms of the prioritization of sectors, and then in terms of the identification of the end recipient, right? So I think if we can get and I think it's happening now in Kenya and hopefully in other countries as well, getting quite serious around gender disaggregated data across the economy, not just as a gender project, so that we understand in each economic sector where women sit, so that we understand demographically in terms of incomes, where women sit specifically, and then even if you can link it to things like geography, because one of the biggest constraints I think that we've been seeing around there is the targeting and the relief. And I think I'd mentioned this previously, that has been the biggest constraint in terms of deploying gender responsive policy, is a lack of data on the back end. So I think it's a work in progress, and this is the time now to get development partners and governments to work together to get a history and a trend and a practice of gender disaggregated data, so that you understand what the possible multiplier effect would be, not just on the sector, but on specific segments of economically active women. So if you're looking at urban women, what sectors should you target? Where do most of the urban women sit in terms of where they earn their living? If it's rural women, where should we target? Obviously, it's agriculture, but are there certain value chains in agriculture? That a lot of women are not necessarily sitting in the cash crop value chain. A lot of them are sitting more in the subsistence agriculture. So those, I think, have been the biggest constraints, rather than a very deep ideological opposition to it. I think it's been the how-to that has been a bit difficult.
Well, and I think that actually gets to a question here from Geeta Patwal. She asks this particularly for the India context, but I think it applies across, is what role do you think the emerging gig economy have, especially for women? She poses it for India. So Soumya, I might ask you first, and I think that builds off of what Nzetse was sharing.
Sure, and just to add to what Anatse was also sharing in terms of, I think in India, it's a huge, it's a time actually to actually start looking at gender disaggregated data. This is something that feminist economists have also been arguing for long. The problem is, I think in the informal sector, it's really hard to get data on women particularly. So a lot of women who would be self-employed in agriculture would actually work as unpaid laborers on their own family farms, and therefore they don't tend to get reported. So it's also the way surveys actually capture them. Similarly, if you look at the urban areas, a lot of the women would actually be working as contractual employees. They would be in part-time jobs. They don't fulfill the condition of, the definition of, what it means to be, fully employed person, and therefore they don't get into the laborer surveys, and they also don't have identification. So even if you do capture the gender data, they will not have the IDs, or at least separate from those of their husbands as well, to be able to get relief. So I think one of the other alternatives, I mean, just to close the loop on what governments can do, is really at this time not look at rebuild, but just recovery at this stage. I mean, and for recovery, there have been solutions like Brazil has been trying something on the emergency basic income, just to to give some relief measures for the next 1 year or 6 months at least for these women's enterprises or women who are working in that sector. So I think that's something that to be considered as well as part of the overall social protection thing, and also to link them most importantly to health. I mean, in India, we have that the Jan Arogya Yojana, and how do you, and IWage has been running projects with private sector firms where you can actually, even informal sector workers can come and apply through an app. We have been seeing that has really picked up after COVID. They really want to get into the insurance net and fulfill those requirements. So that's point one. I think on gig, it's an excellent question. It's something that women really would like to apply for. I mean, let's say from the women's demand side, this is a platform, the gig platforms offer a very lucrative proposal because I can pick up 2 or 3 gigs in a day. I can also look after my domestic chores and my household responsibilities and my children and my food. So the timing is left to me. I think that's what's attractive to them. What is not attractive is, again, the lack of social protection. But then when women consider 2 proposals where I'm not getting social protection, right? Even if I'm employed in, say, a beauty salon. So I might as well actually enroll for a company which is a gig platform which offers beauty and wellness services to customers in Delhi. But at least I can A, get more income, B, do it at my own convenience. And actually, fortunately, the Indian government has been actually opening up discussions on social security codes, even for gig platforms, where the platform owners have to reserve a part of their revenue, for maternity benefits, for other sort of insurance and other benefits for workers. So there is that space, policy and engagement space is opening up in India. But definitely gig is not just for that, but a lot of other informal workers, the female informal workers in the Indian economy, whether you're a domestic worker, there's a platform called Helpers Near Me. But I think the other important thing is if you need training for these workers. So if I'm actually getting into a gig work, is it, do I know what my rights are? If I actually get employed as a domestic worker and I'm connected through a gig platform, do I know my rights and I should not be abused by my employer? Here, organizations like Seva and others come in, particularly in India, where they train, women that, go ahead with the gig platforms, just be sure of what your rights and entitlements are.
I think one of the areas, and Mary Tamari is bringing this up, is the link between sort of restricted movements and gatherings and then that social capital of networks. And so to what extent is that linkage either being a facilitator or a barrier for women in coping at this time? I don't know who might want to take that.
I mean, I could, because we've been looking at this. I think in the beginning, because women do tend to organize themselves in informal finance, the physical restrictions limited that. So what we've seen is that if you look at Q2, Q3, there was still an ability to access support, particularly financial support through the social networks. But as we saw income generation and income shocks continue, the social network itself is quite broke. So the ability for women to leverage the social network, informal financing mechanisms, the liquidity within those structures has really gone down a bit. But there is this other class of women, and that's what I'm saying. If you're looking at women, it's really the gender disaggregated data in terms of income, demography, and sector is crucial, because what we're seeing is income divergence and economic dualism. So to the points around technology, what we're seeing is that if there are women who have been able to pivot where they earn their living, or who have been sitting in sectors and have been able to retain a formal sector job, they've been fairly resilient, as opposed to the bulk of women where the story has been quite different. Same with the economy. Women have been in the economic sectors that have been hit the most in terms of the contraction of sectors. So if you're looking at education, tourism, accommodation, the wholesale and retail trade, even manufacturing to a certain extent, if you're looking at textile and apparel manufacturing in the informal sector, women dominate that sector quite a bit. If you've been able to pivot, fine, but if your sector has been so hit by COVID that there's been no option, So what we're seeing is that this is the time to really start seeing where women will sit when we see this income divergence and we see this economic dualism. Because one of the things also, to the point around the informal finance and networks, the wealthier demographic segments that used to almost serve like a de facto trickle down mechanism in terms of remittances, domestic remittances to members of their social networks that they wanted to support financially. We're seeing two things happening. One is because of the lack of certainty around incomes, we're actually seeing that segment save more. So we're seeing deposits in banks actually, I think they almost doubled now. If you look at the first half of the year this year compared to the first half of the year last year. So even the wealthier segments, women, because of the uncertainty around their jobs and the economy, we're seeing a contraction in their willingness to be as generous. On the flip side, those who are choosing to continue that role, we're seeing an increased debt distress happening there. So what's happening is because of the way COVID has had a very specific impact on sectors, and particularly looking at digital loans, those digital loan providers are tracking that behavior, and we're seeing a consolidation to demographic groups that have demonstrated continued creditworthiness. Women were already over-leveraged, we saw, particularly certain segments around debt. So the risk is that even those women who are been quite income resilient, we're seeing this juxtaposition of deepening debt over-leveraging happening. So I think that's why there's no single story. There's no single story in any of this. And we need to find ways to create a certain level of certainty and predictability so that wherever the woman is sitting, there's a way that she can apply her technical, intellectual, and financial resources in an environment where that benefit will pay off. Because I think the cost benefit now is not a time to be playing around that. I think the shocks are so severe that there's no fiscal space, there's no household space, there's no firm space for any mistakes. So I think that's why it's quite important, for that certainty, to be restored in some way.
All right, and that bell was we are close to wrapping up. So I'm wanting to get like just a kind of a closing thought around either there's quite a few questions that sort of ask around best practices, which we started to touch on in earlier in our conversation, and thinking about including the informal sector, or more specifically, where I see from Swati Vyas, like ensuring that these women in the informal economy are visible and registered, and that these policy gaps for these workers are included. So thinking about that sort of forward lens, give me your 30 seconds of what you think we should either be looking at as a project and making sure we're investigating into to be able to help inform going forward, or even as those who are listening and have some influence in the spaces where they are, what should happen next. So 30 seconds, and I'm going to start with you, Soumya, since you're at the top.
I think, it'll be very useful to also investigate the kind of best practices that Viego and its partners have been documenting with informal workers, and particularly what has happened after the pandemic. So, for example, and they've divided it up into different segments. So, for example, what has happened through waste pickers. There have been a lot of, appeals which have been filed by waste picker organizations, a global alliance working with them, on how to maintain distancing, how to be, maintain cleanliness and hygiene, so that you're protected. There is also, a lot of training that's happening through the Viego partners and their networks on domestic workers, and how do they prevent harassment or even the risk of contracting the virus. I think from home-based workers, again, pivoting their skills so that they can start manufacturing other things like masks. There is also a lot of work that's, on street vendors. Of course, their harassment and their ability to access public spaces has been restricted. But there have been few examples, particularly in Latin America, on how there are best practices that may be encouraged there. But I think one important thing which a lot of organizations that are working with informal workers are also talking about is, so I think somebody touched on tenure security, and I think those long-term investments are really now coming to the fore, because all that they have is the space that they work in. All they have are their bodies, their mental well-being. And are we focusing on that enough? Because one of the big impacts that you're seeing on this informal segment is really the huge setback on health that women are suffering, because they don't have access to solidarity networks. A lot of their savings are being spent, on bringing food to the table, or even just, survival, of their businesses. So the health is really taking, a second this thing. So, I mean, for example, in rural areas, at least we are hearing in India that informal workers are actually, that there's been a rise in stillbirths, just because women are not accessing the usual maternal health services because they don't even have the money to do that, or even to buy supplements. And if those health outcomes, are basically, if they are disadvantaged on that front, they will not have the productivity to even, be self-employed or to survive. So I think health is a big thing that is something that may be worth exploring. And as I said, best practices around what VAGO and others have been trying to document.
Great, thank you, Soumya. Damali, really quick, what's our quick takeaway here?
One thing, whatever you're designing, one thing it should do, it should definitely be able to give finance to the informal sector, because the informal sector no more borrows from themselves or from their own families. This component has been decimated because they can't borrow from themselves. They've all not been working, so they've lost all their capital. So one of the biggest things is that I see our informal sector actually shrinking because their capital has disappeared. So whatever you're designing, you have to be able to give finance. Otherwise, the informal sector won't recover, because where they used to borrow from is disappeared. Their microfinance institutions are dead because no one is paying back. Their families are equally poor and they've suffered the same, so they can't borrow from them. They can't borrow from each other because they're all been locked down. So whatever it is that you're designing, you have to capitalize them. Even if you design it in a way that it will be a revolving fund, they pay back, but it has to be there if you want to restart that component. Thank you.
Thank you. And Zetsi, last seconds.
Stimulus demand, stimulus demand, stimulus demand. The biggest constraint to recovery is that people don't have money to buy. I think the role of public finance is crucial. We're already seeing it buffer, and mitigating economic difficulty. Focusing government and fiscal stimulus on micro, small, and medium enterprises, because those are female dominated. And if you can get to specific feminized sectors to stimulate the purchase of goods and services, particularly things like trade, I think you'll find that once that cash flow starts moving, I think women will start to, do the usual thing of figuring out what to do best in very difficult circumstances. But the biggest constraint is that lack of demand.
Great, thank you. Thank you to all of you for joining us today and the discussion. I wanted to invite Divya Dar to kind of come with some closing remarks. Divya Dar is a senior program officer with the Gender and Equality team at Bill and Melinda Gates Foundation, and she leads a portfolio of grants on gender data, measurement, and evidence with a focus on East Africa and South Asia, including this project. So Divya, could you share your thoughts on the path ahead given this discussion today and the way forward based on the vision of what the Bill and Melinda Gates Foundation hopes to achieve through Rebuild?
Thanks, Cassandra. I think it was an excellent presentation and summary by ICRW and very rich discussion and points made by the panelists. I think there's been a wealth of insights provided today. And on behalf of Bill and Melinda Gates Foundation, I want to congratulate the team and partners. We're privileged to be supporting this very important topic of work with IDRC, given what we know about those at the lower end of the wage scale and the most vulnerable in micro and small enterprises being hardest hit. And we know this is threatening to deepen inequalities in the long run. So the findings and insights from this research and from the partners are going to be crucial in informing policy decisions and actions for these countries. It goes without saying that I think the work that you're doing in ensuring that these relief, recovery, and long-term protection measures have a gender lens is going to be crucial for ensuring that women come out of this in a better shape. But I do want to bring together in our concluding remarks a few strands that came up in the discussion for us as a community to weigh on. to weigh in on in the future in our work. I wanted to echo a number of points that came up. ICRW's emphasis on moving beyond just economic analysis on informal work to actually conducting multidimensional research and looking at how COVID has affected different dimensions of informal work, including GBV, access to health services and sexual and reproductive health, as well as the care economy. The other thing I just wanted to underline, it came up in different parts of the conversation, is that informal workers are not a monolith. They belong to many different types of sectors, whether it's education, travel, manufacturing, all of which have been differentially affected. But they also belong to many different types of worker categories, whether it's own account workers, contributing family workers, home-based workers, or migrants. And so they're all facing a different set of challenges and risks. By diving into these details, ICRW is ensuring that they're peeling the onion and recognizing the intersectionalities and variations that are affecting the set of workers. The other point that panelists discussed, and I know that ICRW is looking into, is actually understanding coping strategies and resilience mechanisms. What are some of the adaptation mechanisms that are being adopted by the informal sector to cope with the fallout of COVID-19? These are all going to be important aspects of the research for ICRW to dive into as they develop policy responses and roadmaps. I thought the analysis was very important in terms of analyzing how schemes have incorporated the informal sector in their provisions. I think there's a very important insight that most policy responses have left out the informal sector. They've been focused on formal sectors and also on employers and firms. There's a lot more that can be done or extended, not only in terms of potentially expanding the fiscal space, but also thinking about other types of protections, public works programs, emergency cash transfers, food relief, moratoriums on rent and utility, many types of recommendations that came up from the panelists. I would suggest that as some of these are researched into and evaluated as potential response mechanisms for the rollout in the future, that as a value add, ICRW not only develop precise recommendations and prescriptions, but also understand the barriers from the government side, from policymaker sides that have come up in rolling out these programs to the informal sector. By the very nature of the sector, these are people who are harder to reach out to, access, and understand, enumerate. So I think developing what in the long term could be a platform to better understand and formulate longer term protection measures will be crucial. With that, I just want to thank you all very much for this rich discussion, and I'd like to hand over to Cassandra, I know that for closing remarks.
Yeah, thank you, Divya. We are really excited about the partnership and looking forward to supporting this vision. I'd now like to ask Cleopatra Mujeni, the Director of ICRW Africa, to share some closing remarks and bring us home.
Thank you, everyone. I'd like to say thank you to our experts, Samaya, Damali, and Zeste, for those very rich insights that you shared with us. And thank you to Diva and to Arjun for also sharing your thoughts on this piece of work. Rebuild aims to provide evidence to help us build back better. And as Anzeste very, very succinctly said, that there is no single story. The heterogeneous group that women in the informal sector actually are has huge challenges and has been affected quite greatly by restrictions and by the responses to COVID-19. So as we look at this group of women who in India, in Kenya, in Uganda, and many other countries contribute so hugely to our economies, we really should be looking at these recovery efforts through this gendered lens. I think all the speakers and the general thread that has moved through this, this entire webinar has been about there is no one way to actually mitigate and respond to these challenges, because they're as diverse as the population of women that we are actually going to be working with and getting to understand better. But it's very important that we do so, because when and if there is another pandemic, we will automatically then be able to think about responses and restrictions through a gendered lens, because as we can see globally, women are the ones who are most vulnerable, and women working in the informal sector are actually the women who have suffered the most, whether it is in urban settings, in rural settings, or as Damali mentioned, even those who work across borders. So for ICRW, this is a very exciting piece of work that we are now launching, and we will be sharing insights throughout the life cycle of the project. There will be more webinars coming up, and we welcome you to participate in this. I'd like to say a big thank you to all of you who attended. You've been a great audience, and the questions that came in were quite broad and very interesting. And I do know that the team has been taking notes vigorously and thinking about how we're going to be answering some of these questions as we do the work. I'd like to thank the team, Sharmishra and Carol, for the presentation of the work that they did. And for all of you, wherever you are, good evening, good morning, good day, good night, and signing off now.